Опа. Ну да, Sternoclavicular Joint. Hello student. Today topic of the lecture general arthrosyndesmology. Question of lecture. classification of joint: fibrous joint, cartilaginous joint, synovial joint, and select synovial joint. The rigid element of the skeleton meet at sites called joints or articulations. The Greek root artro means joint, and the scientific study of joint is called arthrology. Two important functions of bone are support and movement. It's the articulation of the bones at joints and the contraction of skeletal muscles that attach to the bones that cause movement. Joints can be classified as by function or structure. The functional classification focuses on the amount of movement allowed. Sinusoidal are immovable joint. Next, amphiarthrosis. They are slightly movable joint. And next group, diarthrosis, are freely movable joint. Diarthrosis predominate at the limb, whereas synarthrosis and amphiarthrosis are largely restricted to the axial skeleton. The structural classification of joints are based on the material that binds the bones together, on the presence or absence of a joint cavity. Structurally, joints are classified. First, the false joints, synarthrosis as continuous connections. Through joints, diarthrosis as discontinuous, and false joint are immobile articulation characterized by filling tissue between the skeletal element. There is no joint space. They are referred to a fibrous joint, the syndesmosis, the synhondrosis, the synostosis. In contrast, true joints have a joint space between the articulating skeletal element. Fibrous joint. Such as the seams. The bones are tightly bound by minima amount of fibrous tissue. Such as occur only between bones of the skull, and the fibrous tissue is continuous with the periosteum around this flat bone. Stitches may be classified independent structure, plain, squamosa, and notched edges. Sutures not only knit of the bones together, but also allow growth, so that skull can expand with the brain during childhood. Sutures classified sutura sagittalis, sutura coronalis, sutura lumboidea, sutura squamosa, and sutura plana. For example, you see sutures of skull. This is sutura sagittalis, you see. This is sutura coronoideus. This is sutura lambdoideus. It is sutura notched. You see sutura squamosum. Sutura squamosum. Sutura between os nasale and os frontale, this is sutura plana. This is, you see, sutura plana. Sutura plana between processus mastoideus and os occipitalis. This is sutura plana. Sutura plana. Gymphosis is a peg in socked joint. The only example of the articulation of the tooth with socket. In this case, the connective ligament is a short periodontal ligament. What do you see? Periodontal ligament. Located between root of dens and bone of mandibula. This is periodontal ligament. It is connective tissue. Connective tissue. Next, syndesmosis. In syndesmosis, the bones are connected exclusively by ligaments. Bands of fibrous tissue longer than those that occur in situ. The amount of movement allowed at syndesmosis depend on length of the connecting fiber. If the fiber are short, as a distal tibiofibular articulation, little to no movement is allowed. If the fiber are quite long, as in the interosseous membrane between radius and ulna, a large amount of movement is possible. Fibrous tissue can vary its length, but is longer than in sutures. What you see? Ligament. You see ligament membrane. Synostosis. The 2 and 3 three bones are secondary fused by bone tissue. For example, the os sacrum and hip bones. This os is here, os ilium, os is here, and os pubic connect together and connect with help bone tissue. It is synostosis. This is sacroiliac joint. Next, symphysis, a joint where fibra, cartilage, unitus the bones is symphysis. You see symphysis. Example include the intervertebral discs and the pubic symphysis of the pelvis. Symphysis are slightly movable joint that provide strength with flexibility. What you see, pubic symphysis pubicus. What you see, it is fibrous collagen. This is, you see, this is hyaline cartilage, fibrocartilage, intervertebral discs. This is hyaline cartilage and symphysis located has cavity with liqua into discs because name symphysis. True joint, general structure of synovial joint. Synovial joint has next part. Articular cartilage of bones. A joint cavity или synovial cavity. Articular capsule, articular capsule или capsule, and synovial fluid and reinforcing ligament, articular discs and meniscus. It is a typical synovial joint. Articular cartilage, synovial cavity consists synovial fluid and joint capsule and ligament. Articular cartilage, what you see, articular cartilage. The end of the opposing bones are covered by articular cartilage composed of hyaline cartilage. These spongy cushions absorb compressive forces placed on the joint and thereby keep the bone ends from being crushed. Next, joint cavity, synovial cavity. feature unique to synovial joints. The joint cavity is really just a potential space that holds a small amount of synovial fluid. Synovial fluid. Synovial fluid, it is viscous liquid. The joint cavity is called synovial fluid because it resembles raw eggs white. Synovial fluid is primarily a filtrate of blood arising from capillaries in synovial membrane. Synovial membrane. It also contains special glycoprotein molecule secreted by the fibroblast in the synovial membrane and epithelium that make synovial fluids is a slippery lubricant that eases the movement at the joint. It is synovial fluid, mucous liquor. Articular capsule. The joint cavity is enclosed by two light articular capsule or joint capsule. The outer layer of fibrous capsule of dense irregular connective tissue that is continuous with periosteum layer of joint bones. The inner layer of the capsule is synovial membrane composed of loose connective tissue. This membrane covers all the internal joint surface, not covered by cartilage. Its function is to make synovial fluid. This is membrane cover epithelium cells. This inner layer consists many capillaries. Capillaries of blood, with blood. Some synovial joints are reinforced by strengthened by band-like ligaments. Most often ligaments are intrinsic or capsular, that is, they are the thickened parts of fibrous capsule itself. In other cases, the ligaments are extracapsular or intracapsular. Extracapsular ligaments are located just outside the capsule. For instance, the fibular and tibial collateral ligament of the knee. Extracapsular ligaments are divided according to their functioning. Reinforcing ligament of joint capsule. For example, the big pubofemoral and the hip joint. Gilding ligaments for the guidance of joint movement. For example, the ligament annulare radi at the elbow joint, and inhibiting or restricting ligament joint movement is, for example, ligament iliofemoral and the hip joint. This is extracapsular ligaments or ligament ligament extracapsularis. Ligamentum extracapsularis. Now what you see, for example, articular capsule, what capsula articularis, capsula articularis. You see ligamentum extracapsularis. You see blood vessels to the joint. What to the joint? What you see? And patella, articular cartilage, and your patella ligament. It is knee joint. This patella ligament and articular discs. This is, you see, the section of the knee, lateral view. This bone, this is articular cartilage. Next, articular discs. Synovial joint contain discs of fibrocartilage, named called articular discs or a meniscus. Articular discs occur is a temporomandibular or joint, sternoclavicular joint. What you see, sternoclavicular joint, and few other such discs extend internally from the capsula and completely or partly divides the joint cavity in two. Articular discs occur in joints whose articulating bone ends have somewhat different shape. Articular disc fills the gaps and improves the feet, thereby distributing the load more evenly and minimizing wear and damage. Now what you see is sternoclavicular joint. This is clavicle, this head of clavicle cover articular cartilage, and you see sternum manubrium of sternum, and you see this is you see ligament anterior sternoclavicular ligament and interclavicular ligament. What you see, articular disc. Menisci, articular meniscus, also consist of dense connective tissue and fibrous tissue. They look crescent-like, seen from above, and wedge-shaped in profile, and they cover the margins or periphery of the joint surface. This is medial meniscus and lateral meniscus, or meniscus lateralis, meniscus medialis. This is ligamentum cruciforme, what you see. Now what you see, medial meniscus, natural joint. This is meniscus medialis. You see meniscus lateralis. You see ligamentum cruciatum. Ligamentum cruciatum. This is, you see, medial femoral condylus femoralis medialis. Now you see patella. This is ligament. This is meniscus. This is articular cartilage. This is ligament. This is os tibia, os fibula. Joint lips. These structures are composed of connective tissue and fibrous cartilage, and they serve to enlarge the socket of joint. In the human body, joint lips. What do you see? Joint lips. What is lips or labrium? Lips. Labra. Joint lips. What you see? This is joint lips. Joint lips. Joint lips. Are found in shoulder joint, labrum glenoidale. This is in labrum glenoidale. And in the hip joint, labrum acetabule. What you see? Acetabular labrum. They are inhort in the body ring limbus of the respective joint socket. What you see? Labrum. You see what you see? Labrum. This is synovial membrane. You see head of femur, a ligament of the head of the femur, ligamentum teres, and you see articular capsule. This cut. This you see cut. Articular capsule cut. What you see? Synovial cavity. Это you see pubis. This is ischium. This is coxal bone. What you see? Symphysis. Bursa. Latin bursa. Bursa is structured like a joint capsule. Is surrounded by a layer of connective tissue, membrana fibrosa. And inside there are synovial membrane, membrana synovialis, which produced the fluid is the lumen of the bursa. Lumen, вот он, in the bursa. Lumen in the bursa. Bursa. Latin, bursa, Latin verb. The composition of the fluid is almost the sliding of tendons and muscles on the bones and tendons. They can communicate with the joint cavity. What do you see? Bursa suprapatellaris, bursa supracutaneus prepatellaris, and bursa intrapatellaris profundus. What? Bursa. No, located bursa located into synovial cavity. Into synovial cavity. Next, types of joint. Joints typically have a significant range of motion and can be classified according to a number of movement axes, according to body axis or degrees of freedom. For example, next, uniaxial, biaxial. This is have one axial plane. This is has biaxial, has two plane. This is frontal and sagittal and frontal, and what you see, multiaxial. This is movement axis. Number of articulating skeleton element. This is a simple joint, has two bones. Simple joints has two bones. Two bones, what for example, two bones articulate with each other. This is it is simple joints. Joint you see shoulder joint. What you see, this is caput of humerus and glenoidalis of glenoidalis. You see, fasces glenoidalis of scapula, fasces glenoidalis. Composite joint, several bones articulate with each other. You see elbow joint and knee joint. Knee joint. What do you see? This is humerus. This is os radi, os ulna. This is it is bones. The bones forms elbow joint. Elbow joint. It is composite joints. Are composite joints. This is simple. This is composite. Form and shape of joint surface. This is first form. Это cylindrical of roll-like joints. Articulaция цилиндрика. This is this is hinge joints. It is uniaxial which allow flexion and extension. This for example, articulaция talocruralis and humeri ulnaris. Humeri ulnaris. What do you see? This is humeri ulnaris. You see humeri ulnaris. Next, pivot joint, articulaция conoidea. You see uniaxial joint, which allows rotation, movement, articulaция radio-ulnaris, proximalis. Pivot rotatus as a joint head in concave joint cavity. This is uniaxial joint. Uniaxial. Rotational movement. We like of trachoid joint, articulaция trochoidea. This is articulation is uniaxial, which allow rotational movement. For example, articulaция atlantoaxialis mediana. The concave joint cavity turn around a fixed pivot. Fixed pivot. This is wheel-like joint, uniaxial. What do you see? Atlantoaxialis mediana, atlantoaxialis lateralis. Condyloid or ellipsoid joints, articulaция ellipsoidea. It is biaxial joint. This is in sagittal and frontal plane. which allows flexion, extension, abduction, and under adduction, and slight rotatory movement. For example, articulation proximal, articulation proximal wrist, articulation or metacarpiophalanges. It is biaxial joint, ellipsoid, biaxial joint, two axial, two. Saddle joint, articulatio solaris, biaxial joint, which allows flexion, extension, abduction, adduction, and slight rotatory movement. For example, carpo-metacarpal joint of the thumb. It is saddle joint, biaxial. This is allows flexion, extension, abduction, adduction, and rotatory movement. Next, condylar joint. Condylar joint. They have similar curved surface like ellipsoid and cylindrical joint. What you see? What this is? You see articulation joint, like ellipsoid and cylindrical joint. What you see? This is joint, articulation. These joints allow rotational, shifting, and rolling movement. This is, for example, temporomandibular joint, or articulation temporomandibularis. It is condylar joint. Ball and socket joint, articulatio spheroidea, a joint with 3 axes, which allows flexion and extension, abduction, adduction, internal and external rotation, as well as rotatory movements. For example, shoulder joint. This is simple joint. It is biaxial joint. It is has labrum, labrum. What on you see this labrum? This is has lips. This is cavity, synovial cavity. This is a ball and socket joint. Has two axis plane. This is movement rotators. Next, plane of that joint, articulatio plana. It is joint which allows simple gliding movements in different direction. For example, vertebral joint, and midcarpal joint, and Atlanta axialis joint, lateral, and this is intervertebralis joint. This is, you see, next some plane, sagittal, frontal, and rotated. movements of synovial joint. The synovial joints are classified into three basic types: gliding of the one bone surface across another, angular movements, we change the angle between the two bones, and rotation about a bones along axis. Gliding. In gliding, the nearly flat surface of two bones slip across each other. This gliding occurs of the joint between carpalis and tarsal, and between the flat articular processes of the vertebra. Gliding. Gliding movements at the wrist. Angular movement. Angular movement increase or decrease the angle between two bones. This movement, which may occur in any plane of the body, include flexion, extension, abduction, adduction, and circumduction. If flexion decrease the angle between two bones, extension increase the angle between bones, abduction moving a limb away from the body midline, adduction and moving a limb towards the body midline, and circumduction. Latin. I read on the Latin. Circumduction, moving a limb or finger to that it describes a corner in space. Note, for example, movement in sagittal plane, elbow joint, this division, this is flexion, this is extension. This is axis transversalis, flexion and extension, flexio, extensio. Carpal joint, movement in sagittal plane, This is axis transversalis, this is radio ulnaris. This is flexion. What you see? Flexion, extension, flexion, extension. Next, hip joint. This is axis transversalis through the this is joint. You see, this is flexion, this is extension, or anteversion and retroversion. What you see? Movement in sagittal plane. This is moves of bone. Next, shoulder joint, movement in frontal plane. You see, this is axis sagittalis. This is abductor, adductor. Next, carpal joints, movement in frontal plane, axis sagittalis. This is, you see, dorsopalmaris. This is abductor, ulnaris, abductor, radialis. Abductor ulnaris, abductor radialis. Next, hip joint. Movement in frontal plane. This you see axis sagittalis. This is you see moves abductor, adductor, abductor, adductor. This is movement of the bone in joints of body. Rotation of the toning movement of the bone around the longitudinal axis. This is rate-only movement allowed between first two cervical vertebrae. The entire vertebral column also rotates, twisting the whole trunk to the right or left. What you see, rotator, this is interna, rotator, externa. Interna, externa, in transverse plane. Rotation also occurs at the hip and shoulder joint. Rotation on the limb may be directed toward the median plane or away from it. For example, is medial rotation of the lower limb. Limb's anterior surface turned toward the median plane of the body. Lateral rotation, the opposite movement. Supinator, это Latin, supinator and pronator. The terms supinator and pronator refer to movements of the radius around ulna. What do you see? Around ulna. Supination occurs when the forearm rotation forearm rotates laterally, so that the palm face anteriorly. The hand is lying on the back supine. This is standard anatomical position. Pronation occurs when forearm rotates medially, so that the palm faces posteriorly. Hand laying belly side down, as in prone float. Pronation brings the radius across the ulna so the two bones form and xi. What you see? This is what xi. This is rotational movement of the hand. It is elbow joint. Axis rotation. Supinatio, pronatio, supinatio, pronatio. Rotation. The key feature of body joint. This is joint, name joint, articulating bones, functional type, structural type of movements allowed. Now, what you see table with structural and functional characteristics of body joint. What you see this illustration: joint type, joint, articulating bones, structural type, this functional type, movement allowed. Now what you see, for example, skull, you see cranial and facial bone, fibrous, such a cicha, and synarthrotic, no movement, and other. Take photo, please, this slide. Next slide, what you see, continuous. Take photo, please. And you must study this table at home. Next, take photo, please. Table. As the selected synovial joints, we will discuss on next lecture. Goodbye, student.